Hi, my name is April Chen, and I'm a licensed master social worker and therapist with Lord to Wellness. And I am originally from Alabama, but by way of the military, I have traveled quite a bit. We moved from Alabama to Mississippi to Ohio, and now we are home for now until we retire in Maryland. I'm religious. I'm a Southern Baptist girl raised in the church and currently attend church in the community. And I love God with all of my heart and soul. But we see clients from all religious backgrounds and those who have no faith as well. My educational background is it's journalism. I spent 20 years working in journalism before going back for a master's in social work a couple of years ago, almost 3 years ago, from Aurora University. And the shift in the career field was because journalism became a step on you kind of thing, and it wasn't something that was easy to maintain with my husband of almost 20 years being in the military. So I'm a military spouse, and we are preparing for a deployment, and that's something I know very well. So as a military spouse, I like serving that population because it's something I completely understand. Professionally, I started out as a hospital case manager, and I was so excited to be a social worker. And I learned really quickly that as a hospital case manager, my number one role was going to be discharge, discharge, discharge. Give resources, discharge. Give resources, discharge. And we began to see those patients come back and forth to the hospital because those resources failed them or they were unable to access them. And it was frustrating as a social worker because I wanted to make a real difference. So being a therapist allows me to make a real difference, and that's why I chose to be a therapist. After thinking I wanted to be a medical social worker. But the really cool thing is that there are elements of therapy that are medically focused. For instance, I deal with things like caregiver fatigue and someone losing someone with anticipatory grief to cancer. Also deal with a lot of grief. And along that same realm, I have a certified grief-informed professional credential, as well as a certified clinical trauma specialist. So I work a great deal with PTSD, with anxiety, with depression, with couples therapy, and as well with military clients with PTSD. Hoping one day to launch into the ketamine psychotherapy realm. So we'll see how that goes. Also, I am a certified heart math practitioner. And this is where we look at the window of tolerance when we're talking about someone's mental health and trauma. And I have a device that you can hook up to your ear if you come to in-person sessions, which I have available in Laurel for limited in-person sessions. And we are currently looking at where a person's pulse lies within these particular realms of trauma. And it tells us a lot when we start doing mindfulness-based approaches in order to calm their trauma and bring down that fight or flight response that happens. So in my free time, when I can, I like to travel for scuba diving. Love to travel. We're a bit of a foodie family, and we also have 3 cats that we love to cuddle. And I'm kind of a medical show junkie, so I guess that's the in my free time stuff that I like to do. Some of the places that I've traveled to, probably the most unique place that I've ever traveled to was the frozen, cold tundra that I would call Vladivostok, Russia. The reason for traveling there is because we experienced infertility as a family. And we decided in 2010 to go on the adoption journey. And that journey took us all the way to far eastern Russia to adopt a little girl named Katie. And she is now 17 years old. And it took 2 trips to Russia and spending time alone to do that in Russia, and then in Moscow, where we couldn't speak the language at all. We knew exactly 5 phrases, so it was a little intimidating, but I do understand the journey of infertility, miscarriage, and loss. That has all led me up to being a grief professional as well. One of my focuses is grief because I lost both of my grandparents while I was in graduate school, and they were a huge foundation to me. My mom was in my life, but she was very young when I was born. So I understand childhood trauma, not from the sense that, some of my clients have. We hear some really terrible stories, but I understand it because my grandparents kind of stepped in when my mom couldn't to be a parent. But now my mom and I have been able to repair our relationship. And that is a beautiful thing when you can work hard in therapy and repair relationships and also decide which ones need to go. And we work on that as well with boundaries. Other places I've traveled, of course, scuba diving locations like the Bahamas, St. Martin. We've been to most of the places in the Caribbean to scuba dive, but looking forward this year to hopefully going to scuba dive in the Red Sea. So that's something that is hopefully upcoming as well. And other places that we've traveled included Malaysia, Thailand, Singapore, Hong Kong. We did the whole Asian loop. And I tell you, I wish that sometimes we could go back to those places because I was a food wimp, literally a food wimp. I ate rice and a lot of carbs and wouldn't try things because I was worried about it. And when you ask what my favorite food is, well, it evolved. So with the last name Chen, I'm married to an Asian, and he got me into liking sushi. I used to always say, I want Italian food, no matter what. Italian, Italian, Italian. And one day I tried tuna tartare and never gone back. Sometimes we'll have Italian on occasion, but usually it's steak, sushi, all those good yummy things like that. My main clinical specialty is grief and loss, anticipatory grief, cumulative grief, chronic illness, working with clients who have anxiety and depression as well, and trauma, PTSD, childhood trauma, teenage trauma, life transitions, those kinds of things, caregiver fatigue. I also see teenagers who are dealing with school issues, and the parents usually come along and they need help with the 504 or the IEP process to get plans at school so that their kids can thrive. We went through that journey as well with our daughter, beautiful child, but she learns differently. And learning differences are part of the reason that I like working with that population, the ones that really need help navigating the special education process. So I practice cognitive behavioral therapy, dialectical behavioral therapy, some acceptance and commitment therapy, motivational interviewing, lots of family therapy. I see couples, of course, cognitive behavioral therapy. That's kind of talk therapy, the normal kind of thing. I do a lot of art therapy as well in person in our Laurel office, which is at 312 Marshall Avenue. And also just creative interventions. One of my favorite ones for grief is called a smash and mend. And I have goggles and a little hammer, and we take a ceramic something that doesn't matter if it breaks or not. And the client busts it up, and it's kind of cathartic to deal with grief. And then they take and put it in a shadow box and glue it back into whatever shape they want. But the breaks in it, the cracks in it, once it's glued back together, represent a life missing a loved one. And that's smash and mend through grief. So that's just one of the many interventions that I have for grief and trauma as well. As far as my main goals for clients in therapy, I would say that I want them to illustrate behavioral change, understand what is going on, because the first step to changing is self-awareness. Self-awareness is probably the number one way that clients initiate behavioral change. And then just healing. I like to see clients heal. And that's why leaving the hospital was the right choice for me as a social worker, because I'm able to help clients with the case management access. Like if they need resources, or they need housing, or they need food, or they need other educational resources, I'm able to do that, but also watch slowly and slowly and slowly. And it's slower for others and faster for others sometimes, but I'd love to see post-traumatic growth. And that is a beautiful thing in the therapy realm. So what I enjoy most, I kind of alluded to it back there about being a mental health clinician, is that many mental health issues, in fact, the definition of many of the diagnoses, is that it limits someone functionally and socially, occupationally, and across many different domains of life. And I really like helping someone through those different diagnoses and helping them integrate that into their life so they can be successful across those realms. So that's one of my favorite parts of being a clinician. This is something I'll always preach for clients. Self-care is the number one way to stay motivated as a mental health clinician. Number two, I would say, is consultation. Sometimes we get clients that are hard to treat, that experience difficulties that we have less experience with, and things of that nature. So professional consultation is a very important part of being a mental health clinician and staying passionate. Because my goal, and I say this to every client, is to always help the client in a way that is person-centered, that speaks to them. And if it's not working, what I usually say is it's like a long-term relationship in therapy. So if something's not working, please tell me, because I'll be happy to change the approach. Because for every mental health diagnosis, there's 1,001 interventions or more that work for those. And as a military spouse of 20 years, I've been able to adapt. And that's kind of how I compare therapy, as being able to adapt as a clinician. Well, I'm a complete empath. I literally think about my clients at night, on weekends, probably when I should be sleeping. And sometimes my most productive time is 3 o'clock in the morning. Now, I don't see clients at 3 o'clock in the morning, but I might wake up and think about and have this aha moment, like, this is what I need to do with this client that I feel stuck on. So also, another thing that makes me stand out as a mental health therapist, I've noticed that therapists in and of themselves many of them are introverts. I'm a complete extrovert, I'll tell you. Very outgoing and don't like to be introverted at all. But I also like to connect with clients through that extroverted personality. So that's kind of what makes me stand out. If I start with a childhood book, it would be Charlotte's Web. And I really like the persistence and perseverance that Charlotte showed in that book. But if I were to mention a therapy book that has really stood out in my practice as a clinician and in my life, it is The Body Keeps the Score. And it talks about somatic healing and psychosomatic mental health symptoms. And that is a book that I really enjoyed reading for the second time after graduate school and after becoming a therapist. And currently I go through that with a lot of my clients who have somatic and psychosomatic issues that appear due to PTSD and trauma. And what I mean when I say somatic and psychosomatic, they hold their trauma inside their body, and it can manifest in pain, chronic pain. It can manifest in panic attacks. It can manifest in many different ways, depression, all those things. They're all inclusive of someone suffering from PTSD or complex PTSD. And oftentimes, trauma and grief run together. Same thing with ADHD. ADHD and PTSD often run together. So that's also why I enjoy treating ADHD as well. I work with all clients, school age, all the way up to couples, to individuals, all the way to the end of life. I haven't chosen a particular client base that I like working with. The variety keeps me on my toes, I gotta say that. But a lot of times in office in Laurel, if we work with children and some adults, I usually use some art therapy or some kind of game like therapy Jenga. You can buy Jenga that stacks up on the table and then write a list of questions. And as they pull out the blocks, they answer questions. And so I like the creativity of working with all ages. So I welcome you. If you decide to choose me as your therapist, I can promise you that I will 100% do my very best to help you. And thank you again if you choose me for your therapist.